Hello everyone. Welcome to Yashoda Hospitals online segment, the Health Talk session. The incidence and prevalence of brain tumor in India is growing. There are a lot of myths and misconceptions about brain tumors among the general population. We take this opportunity to discuss and get your answer clear. Do post your queries on the comment section and we'll get them answered at the earliest. I'm Dr. Lakshmi and let's welcome Dr. Anandh Balasubramaniam, Consultant Neurosurgeon from Yashoda Hospitals, Secunderabad. Welcome, sir.
Thank you.
To start with, sir, how common are the brain tumors in our country's population and which age group is most commonly affected?
Thankfully, brain tumors are not very common. If you take about 100 cases of tumors anywhere in the body, thankfully brain tumors form less than 1 to 2% of those tumors. But as you asked regarding age, in children, they are the commonest solid tumors in the body. Apart from blood cancer, brain tumors become the most common solid tumor in the body. So in children, it's a major problem. And in adults, as age progresses, you tend to develop more and more brain tumors. So extremes of age, it's common, and thankfully the burden is not as high as other tumors. But given the large number of people in our country, the absolute numbers are still very high.
So taking few questions from our social media network, we've got Mr. Kiran from Hyderabad asking us what are the most common symptoms of brain tumor presentation and when should one suspect?
So commonest problem with brain tumor because of the growing mass inside the skull is headache. So this is very common in adults and late adulthood, and even in children who are older than say 5 to 10 years of age. In young children, it may be increasing head size or head circumference because the tumor is growing and the skull bones have not yet fused. Now this headache tends to be early in the morning headaches. It may be very severe with vomiting, and it gets worse day by day. Suddenly people will get worried all headaches may be related to brain tumor. It's not so. There are so many reasons of headache. If the headache comes routinely, regularly, and it is the same intensity over a period of time, it could have so many other reasons, from stress to hypoglycemia or even migrainous headaches, etc. But if the headache is becoming severe day by day and is associated with vomiting which relieves the headache, and especially it's more common in the morning, with or without blurring of vision, this headache has to be taken seriously and one should attend a doctor's consult. Other than headache, there could be other issues like a seizure. Patient can get fits. That could be a sign of something getting irritated within the brain. Again, fits are very common up to 25 years of age. We call them idiopathic, no specific reason. But in the adult age group, if somebody gets fits, then one should look for other reasons other than it being idiopathic. Means there could be some reason for the seizure. It could be also a tumor. So one should get a scan and check out whether there is a tumor related to this. Apart from these two symptoms, one can have loss of the function of a particular part of the body depending upon where the tumor is arising. If it is arising near a particular nerve and pressing on it, that function of that nerve may be lost. Like for example, loss of vision or loss of hearing, loss of ability to swallow, inability to move say one side of the face, or inability to move the eye producing double vision, or hand or leg weakness, or any part of the sensation in the body decreasing.
So sir, talking about headaches secondary to brain tumors, are there any different from the headaches presenting with migraine?
Yes. So migrainous headaches tend to come alternatingly. It's not in the same part of the head. It may be sometimes on the right, sometimes on the left. There may be important triggering factors. And even if you don't treat, if the patient just takes rest, it may just go away after a few hours. Whereas headache due to raised pressure because of a tumor in the head will not go away without treatment, or is likely to be associated with vomiting and blurring of vision, with the vomiting relieving the headache. And this headache, every time it comes, will be severe than the last time, and it progressively worsens. So that is a little alerting or alarming, rather than a migraine headache which tends to be of the same severity every time it comes.
So taking the next question, we've got Mr. Sanjeev asking us from Karimnagar. He wants to know if all brain tumors are cancerous.
Thankfully, no. But most of the tumors tend to be cancerous. Majority of the tumors tend to be cancerous. That means they are malignant. But one advantage of brain tumors compared to rest of the cancers in the body is that it does not spread to elsewhere in the body. It keeps recurring in the same site and it can spread within the brain, but it does not metastasize or spread to other parts of the body like the lung, liver or bones, etc. So that is one advantage. Other reason probably is that there are a lot of benign tumors. There are a lot of benign tumors that can come from all the nerves covering the brain, the covering of the brain itself called the meninges, and it could be also related to other structures which in the head like a pituitary gland. So all these tumors also form a large bulk, but these are all benign tumors. Thankfully, benign tumors can be cured. These malignant tumors are a major challenge. The earlier we diagnose them, the better the outcome is.
So talking about malignancy, sir, are the malignant tumors curable?
So in the brain, as I said, most of the tumors in the brain seem to be malignant, majority of them, especially the ones that children develop, and once the late adulthood tumors which come are malignant, tend to be malignant. Even if they be of a lower grade, they may become higher grade malignancy over a period of time. So one has to catch them early so that we prevent them from spreading or increasing in size. So early diagnosis is very critical so that we can control these tumors. Cure in these tumors are nowadays being talked about, but it's still a distant dream. The earlier we diagnose these tumors and the more aggressive we are with a good surgery and good adjuvant therapy following surgery with proper care, some if not all of these tumors can be controlled well and even be cured in a few of them.
Do post your queries on our social media network and we'll get them answered shortly. So taking the next question, we've got Mr. Ajay asking us from Vijayawada. He wants to know what are the non-surgical methods to treat brain tumor.
So brain tumors can be treated both surgically and non-surgically. Sometimes non-surgical treatments are given as adjuvant therapy following a surgery, but sometimes non-surgical treatment may be the mainstay of treatment. So benign tumors or even metastatic malignant tumors from malignancies or cancer elsewhere in the body, when they come into the brain, they may be very small. The important criteria for this kind of treatment is the size. If the size of these tumors are less than 3 centimeters and they are not present in very, very important critical locations, nowadays they can be treated with a very highly focused radiation called stereotactic radiotherapy or stereotactic radiosurgery. So we have various types of machines. Many of you may have heard of CyberKnife, Gamma Knife, X Knife. So various hospitals have various of these instruments that are based on LINAC or gamma rays or proton beam therapy even. But the basic principle is that they are highly focused beams of radiation which exactly conform to the shape and size of the tumor from all directions. So the surrounding tissue in which the tumor is buried in does not get any side effect of radiation, and a high dose of radiation is delivered to the tumor which is less than 3 centimeters in size. So they can be upfront directly the primary therapy when you diagnose brain tumors on an MRI scan, or if for some reason we have not been able to remove a larger tumor which is more than say 3 centimeters which required surgery, we have been able to downsize it with surgery to less than 3 centimeters because of surrounding nerve tissue which need to be preserved. If we leave behind some tumor in interest of safety, that residual tumor can be treated again with stereotactic radiosurgery or radiotherapy. So yes, there is treatment available without surgery and it is useful in quite a few of those tumors.
So sir, now that we are discussing about the treatment part for the brain tumors, what are the recent advances or newer techniques in treating brain tumors?
So the understanding of brain tumors and the technology used to treat them have developed vastly over the last 2 to 3 decades. So previously the surgery, even we could not visualize the tumor before we operated. We were operating with only X-rays, but now we have recent advances like wonderful MR imaging. We have a 3 Tesla MRI scan which can give us beautiful images of the nerves, not only the nerves and the tumor, but also surrounding tissues which are eloquent, like we have special images like DTI, which will even show where are the nerves that is controlling the movement of hand, thumb, or even speech located within the area of the tumor. Is it being pushed by the tumor? It's being invaded by the tumor? Is the tumor resectable safely without damaging these nerves? All these informations are available a priori, even before surgery. So we can plan an effective surgery. During surgery, as per the imaging that we have obtained, we can even use methods like navigation, which will precisely take us to where the tumor is and also precisely show us where the normal tissue is which need to be preserved. So this is another great advancement in technology. Apart from these, we have special techniques to remove the tumor like ultrasonic aspirator. We also have special techniques to monitor the nerves, to preserve the surrounding nerves like intraoperative neuromonitoring. And at the end of it all, if we want to see whether the whole tumor has been removed effectively or not, we have intraoperative imaging like ultrasound or even MR imaging, the same 3 Tesla MRI which is used for diagnosing the tumor. In some hospitals like our hospital, we have it inside the operation theatre itself to perform what is called an intraoperative MRI to see that we have achieved total resection of the tumor, or to assess what is the safety of what procedure we are doing, so that we can proceed ahead to safely resect the tumor. So all these advances are technological advances which has made brain tumor surgery more aggressive but more safe for the patient.
Do post your queries on the topic brain tumor and we'll get them answered shortly. So moving to the next question, we've got Mr. Raju asking us from Hyderabad. He wants to know how safe is the surgery for brain tumors?
So brain tumor surgeries are all quite risky. It's like heart surgery. Once you operate on the heart, people are scared. So brain surgeries also, people are very scared because it can be very risky. They are worried that their memory may fail, they may be unconscious, or they may develop paralysis. So this risky involvement of brain surgery, the amount of risk taken or involved, used to make even surgeons be less aggressive in removing these tumors, to err more on the side of safety. But because of recent technologies, we are able to identify and preserve the normal nerves to avoid these problems of developing paralysis or developing a deficit which is not warranted, or having any issue with the surrounding tissue. The surgeries have become quite safe. So more often than not, the patient will continue to remain the same way as he or she was before the surgery, after even a very complicated brain tumor surgery. And to make this possible, we have all the technical advances, and if one gets treated in such a center, then the chances of them being very safe from the surgery is very, very high. Namely, use of intraoperative monitoring, use of even good anesthesia techniques. We have new anesthesia techniques called awake anesthesia, where we can operate when the patient is awake and talking to us and moving his hands and legs, so that we continuously monitor and check whether those functions are impaired or not. If they get disturbed, we immediately abandon the surgery so that the patient does not develop a permanent deficit or a dysfunction. So brain tumor surgeries can be done safely and effectively these days.
So sir, talking about surgeries and treatment, are there any precautions the patients should observe after treatment?
Yes, after the surgery, most often patients will be advised based on the pathology report to either follow up with the radiotherapy or chemotherapy, which may be much better than the chemotherapy given systemically, like oral tablets, which may be effective in brain tumors. So one has to complete the full course of treatment to have the good effect of surgery, especially in malignant tumors. After the surgery is done, the patient gets the treatment with adjuvant therapy. They have to be in constant touch and follow up with the surgeon, so that you pick up any recurrence of tumor that may happen at any time in future. The earlier we detect, then the options of using even non-surgical intervention becomes very high, or even cure becomes very high. So a constant follow-up, like repeat MRI scans every year or every 6 months, as the case may be, as advised by the surgeon or radiation oncologist, should be followed regularly. And of course, physiotherapy, wherever that is required or advised, has to be followed, so that if the patient has developed any neurological weakness or deficit in the hands or legs or face, they tend to improve only with active physiotherapy and participation from the patient.
So moving to the next question, we've got Mrs. Shanti asking us from Guntur. She wants to know, does using of mobile phone for a long time predispose one to brain tumor?
Yes, this has been a very important burning question for all people ever since cell phones have come into vogue. Now we have cell phones for almost 2.5 decades, and there have been plenty of studies that have been done regarding exposure to cell phone radiation and its relation to brain tumors. There has not been one study that has shown convincingly that it is causing brain tumors. However, there is no study to refute the allegation that it may produce tumors either, because we do know that radiation is harmful. So anything which goes beyond normal may be harmful. We'll come to know only after maybe another 20-30 years of usage, because it's very young at its infancy even now. So even the government has taken steps to make sure that the radiation emitted by cell phone towers and even by the cell phone itself is not beyond a certain permissible limit. So that's called the SAR value, specific absorption rate, and all of us will be able to find it in our mobile phones. That is a safety value, and it should be considerably low, below the prescribed limit. And same thing with cell phone towers, one has to be careful. And when one is using cell phones, it's good not to use it constantly for a long period of time. Better to use hands-free devices, especially children, because they have a long way to go, and we do not know what the radiation exposure will produce 20 years, 30 years from now.
So sir, apart from radiation, what are the other risk factors which predisposes one to brain tumors?
So other than cell phone radiation, we do know that X-ray radiation can cause brain tumors. This has been seen in people who have received X-ray radiation for some reason, and then they have been found to have tumors developing, or a old benign tumor changing malignant has been documented. Apart from this, some of these tumors can be hereditary. That means it can be passed on from one generation to another generation, from father to son, from mother to daughter, etc. But these are very rare tumors, genetically predisposed tumors. They are not very common, thankfully. Some rare viral infections are known to predispose to tumors, but majority of the tumors as of today, we know we don't have any valid reason or no knowledge of why it is being caused.
So moving to the next question, we've got Mr. Rajesh asking us from Chennai. He wants to know, if a patient undergoes surgery for a brain tumor, can he take COVID vaccine?
Yes, this is a very common question that comes up with most patients who have undergone treatment before, calling up to ask whether they can undergo vaccination for COVID. There is no contraindication. In fact, prior brain surgery or brain tumor treatment is not a contraindication for undergoing vaccination of any sort for any other disease. They don't have any correlation. And in the presence of this COVID pandemic, there are some patients who have delayed their treatment for brain tumors. So it is a matter of weighing the pros and costs between delaying the treatment for brain tumor versus waiting for the COVID pandemic to pass away, or the risk of developing COVID infection. So that has to be discussed with the doctor before you can postpone your trip, depending upon what is the tumor and what is the symptom the patient has. So one should not unnecessarily postpone and land up in a situation where the situation becomes untreatable.
So sir, what are the preventive health checkups that can be done in a hospital for patients presenting to your clinic?
So if a patient is asymptomatic, there is actually no need to screen for brain tumor, unless of course patient is aged, say beyond 60, 65 years, then the incidence of them developing benign tumors like a pituitary tumor or a meningioma goes up. So they can be screened to look if there have been any tumors that are present which are hidden or which are asymptomatic, which can be picked up and monitored before it gives trouble to them. Very particularly, people who have had anybody related to them or in their neighborhood with brain tumors, if that is present, one can undergo a checkup just to make sure that they are also not undergoing the same external influences to develop a brain tumor. So there are some tumors, as I said, could be genetic, so could be passed hereditarily from one generation to another. So in some of those tumors, the doctor itself will specifically advise you to make sure that if one of the siblings has got a tumor, the other siblings develop the same tumor or not by doing a preventive health screening or checkup on a regular basis. So that becomes important. And of course, for people who have already undergone treatment and cured of a brain tumor, it's very, very essential to have mandatory preventive health checkup follow-ups as advised by the surgeon, either yearly or every alternate year, so that you don't develop the same disease again and keep the risk as low as possible.
So this brings us to the end of this session. Hope all your queries on this topic were answered. Thanks for joining us, and we look forward for your active participation. Thank you and stay safe.